Hey team, today I'm going to be talking about the best way to structure your new patient first visit fee so you have a lot more patients calling in, coming in, and moving forward with your care rather than the stereotypical new patient first visit fees that sabotage more new patients from booking with you or attracting in the wrong new patients. The tire kickers, the $17 Facebook ad type of people, you know what I'm talking about. So if you don't know me, I'm Dr. Josh Wagner, creator, founder of Patient Mastery, where we help amazing chiropractors become the go-to DC in town with financial freedom, more time off, without ever feeling like a salesperson in practice. So this topic came up because recently a doc reached out asking, what should he do for more new patients? Stereotypical stressed mindset. First thing I do, and there's many different answers to handle this, but mindset is first. Second, which we're not going to get into. Second, I looked at his website and I looked for the 6 DC website must-haves to get a lot more bookings. And you can find those in another training. If you're looking for it, comment 6 DCs below and I'll get you a recording. But there's 6 absolute must-haves, and it doesn't mean you got to go spend $5,000 on a new website. You don't need to have a professional video, nothing complicated or expensive or anything like that. And I noticed he didn't have most of them. However, the one thing that was a blatant sabotage was this big circle on the homepage that said $47 new patient special, exclamation. Right out of the box, it feels like it's 1980s, 1990s advertising. But second, and I think it included the adjustment, so it wasn't just a $47 exam. When you position your first visit like that, whether it's a Facebook ad, whether it's your normal on your website for everyone, whether that's how the CA tells people calling in, when you position a low fee, and by the way, I'm not going to tell you low fee or high fee or what to charge. I'm going to share with you a 3-step process that we do in Patient Mastery that positions you excellently and has a lot more people come in for the right reasons. But here's what happens when you have a really low fee. You're thinking, oh, I'm making it easier for patients. Maybe I'm undercutting my neighbors, like I'll get more flow in. And that's what you're thinking, and the logic is correct. But think about who you're attracting in. Someone who's got a serious issue is going to see a $47 first visit with an exclamation as a new patient special and think, this is probably not the level of quality, of superiority, of professionalism that I need for this disc issue, these chronic migraines, this chronic sciatica. Hey, maybe that's for I just need 1 or 2 visits, want to feel better, something like that. So you got to be really careful. Same thing when you do the Facebook ads. If you're going to do Facebook ads for low fee, that you're going to get a lot of no-shows, cancellations, just absolute tire kicker, waste of time patients, and hopefully you get good patients, and that's what makes it worthwhile for the ad spend and to deal with the no-shows messing with your schedule and the just patients that aren't supposed to be in your practice. But we're not even talking about Facebook ads. We're talking about right on your website. When you advertise that, it is attracting in, most likely, the patient who's not going to stay, not looking to follow recommendations, just looking to get away from you as soon as possible and get as much relief and as much benefit in 1 or 2 visits. So the question isn't, how do I get more new patients? It's, what are you doing right now? What message are you sending out to your community of the type of provider you are? Now that's on the low end. You're going to lose people who are looking for a real provider and real care, and you're going to attract in more of the tire kickers, more of the people that don't want to spend more than $47 on any visit. Actually, that's another point I forgot. If you're saying your first visit is X amount, that sets the seed in people's minds that future visits are going to be that amount. And I don't think this doc was charging $47 each subsequent visit. Really, really important. The perception you're planting in new patients' minds, especially when they're doing their homework, they're comparing, and they're stressed because they're probably in pain. Now, on the other end, that doesn't mean you should be, the $350 first visit, and from a perception of, then people will value me. You may, there's nothing wrong with that, if you're okay losing some people because you're not doing what I'm about to tell you. Realize that it's okay to have a very high exam fee or very high first visit fee, If you've proven that you're getting the amount of patients you want a month paying for it, absolutely fine. Just realize that your collections, your income, your livelihood as a chiropractor is not in any way, shape, or form coming from your exam fee or your first visit fee. I don't care if you get a lot of new patients a month. Your collections, your income is coming from people paying you quality fees and staying with your recommendations, and then ideally staying after that. That's where a chiropractor's income comes from, not supplement sales, not, trying to do an online course. It's patients paying you for a course of care and ideally staying with you in some way, shape, or form after that. Not your first visit fee. Now, that doesn't mean make it free so it's easier for people to come in, because making it free for an adjustment is absolute sabotage. Or an exam, people aren't going to take it as seriously. So realize there's negatives to both the high end and the low end. Now, you're probably watching this and you're somewhere in the middle, like you have a first visit fee or an exam fee that just feels good to you and you don't get that much resistance. Now, insurance to cash, like if people are looking to just pay their copay and your first visit exam or first visit is more than a copay, that's a whole different story. We're not going to tackle that here. But in Patient Mastery, we have just this beautiful professional new patient CA call script that doesn't come off all weird and wonky, like asking them to bring their whole family on the first visit or any of that Chiro jargon babble from the 80s. So here's the 3-step new patient process that works beautifully, positions you as a professional, trustworthy, and the expert. So the first one is, there's 3 steps. There's your consult, which is just a conversation with the patient, with the doctor. It might be 8 minutes, it might be 10, 12, maybe it goes as long as 15, but it's a conversation. You're not putting your hands on them, you're not doing any exams or tests, and no treatment is given. So consult is step 1. Step 2 is your exam. You're not treating whatever your exam is, x-rays, palpation, scans, posture, whatever it may be. That is step 2, a physical, objective exam. Step 3 is actually when you start giving care, whether that's the adjustment or maybe modalities, actually care. Those are 3 separate pieces. Now, they could all be combined on one visit. They could be broken into 2 visits. I wouldn't recommend doing it more than that, but I'm just reiterating that those 3 steps aren't 3 separate visits. Now, who do you think of when you think of a doctor in the highest regard, the doctors that get paid the most out of pocket? So usually not oncologists or orthopedists, those are mostly insurance-based. Who's the doctor you think of that gets paid the most out of pocket and people don't even blink an eye? Usually plastic surgeons. Insurance and aesthetic plastic surgeons. Insurance isn't covering it, it's high fees, results-oriented, and people know they're going to be putting a credit card down and it's going to be expensive. Plastic surgeons don't make their first visit consult or exam super expensive compared to their treatment is usually super expensive. But the consult gives a person the ability to connect, see if they like the doctor sees, is this a case I can confidently and honestly say I can help, and it gives you the ability to create connection. And they do that most often complimentary. Now, for you as a chiropractor, the 3-step process to introduce yourself to a new patient, make the consult complimentary. It's worth it to spend a few minutes that you don't get paid for in Patient Mastery, we teach a 6-question new patient consult that will position you as the best doctor they've ever seen in their life. They want to refer to you immediately after having that conversation and want you to find what you're looking for in your exam and start care with you. So give that away because you're increasing trust, leadership. There's no resistance to a patient. It's even less than their copay. So especially if a patient just wants to use their insurance and maybe you don't accept it, they can still have a complimentary consult with you. And that's cheaper than going to the in-network doc down the street and they're gonna have to pay $20 or whatever their copay is. So starting off, removing resistance, building trust, because you're telling them in that complimentary consult, if I don't believe you're a case for me or if I can't help you, I'm going to show you who can. I'm going to refer you to who can. You build expertise, leadership, trust, and rapport when you do it correctly. Consult is complimentary. So rather than having a set fee on your website, let people know. Call today or book today online for a complimentary consult with the doctor. If we can't help you, if he or she can't help you, we'll let you know who can. Now, when someone books, obviously they're still going to have a phone call with your CA. The consult is complimentary. If they move forward with an exam, which would be immediately after, that's when you have a fee for your exam. And you can choose what range or what spectrum. Do you want to be a low-end fee? I'm not saying there's anything wrong with it. Do you want to have a very high-end fee? But the patient is not obligated to that just by coming in and speaking to the doctor, being heard, and getting an initial recommendation. Should we go forward with the exam or should we refer you out to someone else? So complimentary consult, paid exam. There is no bait and switch. They're not told that the exam is paid and then surprised afterward. The doctor doesn't have to bring it up. They get told 3 times before, on the phone with the CA, in an email prepping them, and when they check in for that first visit and fill out whatever paperwork, all 3 times they're let known. They're told, start with a complimentary consult with the doctor. If you move forward with the exam, it's going to be X. No care, no treatment, that's step 2. And then the doctor, after you do the exam, whether it's on the same day right after, or you bring them back for another day, there's different options for both, that's when you go over the fees for going forward with care. And it doesn't matter if you adjust visit to visit, or charge visit to visit, or create a care plan and create savings, if it's a hybrid cash insurance hybrid, if it's PI, if it's Medicare, if it's straight cash, it doesn't matter. Like, this 3-step process works. So if you find yourself stuck at a collections level and your focus is just more new patients, but you're still having the same leaky bucket, still having the same number of new patients come, your conversion rate isn't great, people aren't easily and happily paying you out of pocket and following your recommendations and staying after those, you've got to start looking at other aspects of your practice than just, where do I get my next new patient? And this is one little piece of the patient mastery proven process to position you as the go-to doctor, the most trustworthy, the best in your area, to be able to build leadership, rapport, trust. So patients want to pay you, even if they thought insurance was going to cover it. So you start with the 6-question patient mastery consult. You do the exam. We have a 5-step recommendations combo that's less than 10 minutes, 100% professional. You'd want your own mother to experience this if she was a patient. And then expert care recommendations and plans on paperwork that is super, super easy and simple for patients to say, yes, can I get started today? So recapping, for more collections, be a go-to chiropractor, start new patients on the 3-step process, meaning this is planted in their minds. It doesn't mean it's 3 separate days or anything like that. First, interaction with the doctor is a complimentary consult. Exam is paid. Obviously, care is paid. So don't position the whole first visit as just one fee. Don't combine care with that one fee. Separate exam fee from complimentary consult, and you will build a foundation for higher quality new patients seeking you out, finding you, and choosing to go forward with you. Thank you for watching. Thank you for all you do helping people get back to their life. You absolutely deserve to get paid incredibly for it and have a life you love for helping so many people have the life they need and they want. If you want help specifically with this, reply or comment below more, M-O-R-E, and I will give you a video on the 3, or you can do the 6 must-haves on the website. I'll give you that video, or I will give you the 3 first strategies I teach every chiropractor I work with, and the ability to have a call with a coach on my team to help show you what's a game plan for breaking past the 20,000 a month mark, the 40,000 a month mark, the 60,000 a month mark, or the 84,000 a month mark, because it's different at every level for every chiropractor, and you most likely fit in one of those categories. And if you're done being stuck, we'll show you what's missing, what you're not doing, what needs to be done, while being the go-to chiropractor in your community. All right, so comment below if you want that, and I will see you in the next training. Thank you for all you do.